Thank you for joining us today. My name is Amy Nicholas, and I'm with the DaSy Center. This session that we have put together for you today, we're really excited about. We're going to do a lot of data sharing and a lot of good discussion with you all around Part C data disruptions related to the COVID-19 pandemic. So on the call with us here today, we're happy to have three state staff. Nate Talion from California, down there we're all on camera, Maggie McCall from Indiana, and Barbara Simpson from North Carolina. And then my DaSy colleagues with me today are Tony Ruggiero and Sharon Walsh. So as I mentioned just a few seconds ago, we are going to hear from these three states today as they share data around what they're seeing regarding impact of the pandemic on various categories of data. We're going to talk with each other and with these state presenters to hear about what they're thinking regarding upcoming data submission requirements. Those coming up shortly next month and in February. Share and learn strategies from one another on how to approach disruptions in data or any data quality issues that we may be seeing in preliminary analyses for submissions or new ideas for analysis. We're going to start with just a couple of minutes around some check-ins and assumptions, and then we'll get right into those state data presentations. We will then go into small breakout groups around different categories of data, and you will be randomly assigned to those groups. There will be one of the state presenters in each group and a DaSy staff member. And then we'll do a whole group report out debrief and some closing questions and comments. So Sharon's going to get us started with a little check-in.
Hello, everybody. Greetings. We are so glad that you were able to join us this afternoon for most of us. Some of you probably still morning. Glad you're here. As we approach and as you are working heavily on your federal data collection requirements, I'm sure you've got many state collection requirements, people asking you all day long, do we know how many? Let's pause a minute. We're going to pull up a poll and just do a quick temperature check of how you're feeling right this minute. Could you pull up the poll for us, Rachel? And then we'll get into our series. So how are you feeling? Got 4 choices. Some of these choices probably depend on the hour of any day of the week. Good, finally somebody's cool as a cucumber, but blissfully ignorant. Go another couple of seconds. We have a couple more folks probably want to weigh in. You make a choice and we will record it. Looks like what day is it is definitely winning. I think we can all resonate with that feeling. What do you think? We have close to everybody. You want to freeze the poll? Okay, so clearly the lead was, what day is this? For heaven's sake, what day is this? Closely followed by, or not closely, but followed by the other 3, which is bring it on. We're always glad when we see a group of us, and I bet you everybody has a moment of the day at least, if not more of the day, saying, just bring it on, I can do it. And then a couple of don't remind me's and cool as a cucumber. So let's move on to more serious matters, which I know we need to discuss. And I'm just going to do a couple of things, couple minutes here at the most, before we go on to the most important part of this session, which of course would be our state presentations. If you've been on some of the calls in the last week, you've seen that we've been fortunate enough to get some additional guidance from OSEP related to the disruptions to the data that you are collecting, analyzing, and reporting. And so the directive that we've received now is that make sure, as you're preparing your SPP APR, that if your data are impacted by COVID, and probably much of it is, but certainly not all of it, you must include in the narrative those 3 bullets worth of information. So the impact that COVID has had on your completeness, validity, and reliability related to that specific indicator, an explanation of how that impacted your data and your ability to collect the data accurately and of high quality, and then what steps you took to mitigate those impacts on your data collection. So be thinking about that. We've just gotten that word in the last week, and no doubt you'll spend some time discussing it among each other and later on as well as you proceed to your submission February 1. So on the next slide, I'm just going to mention a couple of assumptions before we begin. The major assumption I think that's worth mentioning is that many of you, and we see who's registered and see who's here, many of you have been involved in a lot of cross-state conversations about data disruption since February, March, April, and up until now into the fall. And many of you have been involved in daily in-state conversations about data disruption. Our goal, as you know, is always just to keep that conversation moving, create forums and events so that you can keep on sharing with each other, not only the challenges and dilemmas you're facing, but the strategies you're coming up with. So that's kind of the first assumption, is that the answers are among this group of folks, and you just need time and a place to share them with each other. That kind of gives us a positive thought about moving forward. And then there's two others I want to mention. One is, and I think they both are clearly assumptions that probably go without saying, but maybe give you some lens to think about these state presentations from. And so the first one of those is that data have been and data will continue, no doubt, probably even more so, to be essential to how you're managing your way through the COVID experience. We have no idea what's going to happen. We have no idea when it's going to happen. And so having the data available so that you can document changes, document impacts, use data to make decisions as you move forward, watch what's happening for funding, numbers of services, numbers of providers, availability of protective gear, et cetera, et cetera, et cetera, data on so many things, and that those things for you are key to making decisions and to keep moving forward in a positive way. And then last but not least is that embedded in that, or essential part of that component, is change. And the changes occurring federally, the changes are occurring certainly at your state level, your local county, community level, your local programs and provider level, and certainly within families, individual families that you work with every day. Changes in every part of their lives, children that are being educated at home, parents working at home, issues around funding and finances and food and rent, mortgage, et cetera, et cetera. And so the more those changes provide the context for all the work we're doing, and you know they do, the more it becomes important for us to document the things and the events as they change. You're going to see some really good examples of that from the state presentations today and hear from your colleagues. But so what was the day that you allowed face-to-face to begin, if you did? And who's making those decisions? Was that July? Was that September? What was the day you started virtual back in March or April? What was the day that, or the 2-week period when you didn't do evaluations? Marking and making sure that you document, even though you think you'll remember those things, documenting those things as you go so that those can provide the context around your data, which will help you use the data more effectively to make decisions. So having said all of that, giving some frame perhaps for you to listen and think and ask your friends and colleagues questions, I think we'll move on to the presentations. And we have 3 for you. We'll pause between each one so you can ask some questions or share some ideas. And we are really pleased that our first presentation will be your friend and colleague, Barbara Simpson from North Carolina. Barbara?
Good afternoon, everyone. As Sharon said, my name is Barbara Simpson. I am on the data team for the North Carolina Early Intervention Branch, which is our Part C program. And I'm here to talk to you today about some interesting stuff that we found when we started digging into our referral and eventually our enrollment data. So if we could go ahead onto the next slide. So like I said, I'm going to talk about the impact of changes in referrals on our enrollment. The data team in North Carolina has been really fortunate. We were asked really early on to start tracking several of our programmatic indicators on a week-to-week basis. I think we started back in late April, looking at everything from referrals, evaluations, new IFSPs, new services, COSAs, exits, all of that, and looking at it on a week-to-week basis. But in addition to that, we were given what we call Data Wednesday. At our Wednesday leadership meetings, we're given a half hour that's just set aside for data. So in addition to talking about that tracking data, when we found something interesting as we dug deeper into it, we would see things in the data and do a little extra analysis. We had that space where we could talk about what we were seeing with our agency's leadership and get perspective, get some context around it and get some ideas for more and deeper analysis. So the data that I'm going to be talking about today came out of that process of looking at data on a weekly basis, finding something interesting and being allowed to dig and have time to tell people about it. So what it really boils down to, and what we're going to look at through the rest of these slides, is that referral source has a huge bearing in our program on your likelihood of enrolling in the program, and changes in where our referrals are coming from are continuing to impact our overall enrollment. So if we can go to the next slide and get me my first bar. I hate doing graphs with two different axes on them, but I had to do one anyway on this one because I didn't feel like I had a choice. The line you're seeing right now is our week-to-week enrollment data starting back the first full week of January through the end of the fiscal year at the end of June. And you can see we had a big drop in late March and early April, down at one point to where we were only seeing about a third as many referrals a week as we were used to seeing when things were normal. And while it has rebounded, we're still not back to the place where we were. I think most weeks were like, at this point, we're about 25% below normal referral levels. I think at the end of the fiscal year, we were still only at about 2/3 of where we were used to being. So the next line you're going to see is our head count over that same time period. And as you can see, those are two very, very different lines. While we had the huge drop in referrals and then the rebound, with enrollment, our head count, it's been this slow sort of pecking away, where, every week it's just fewer kids. And that pattern has continued on even into the most recent data from this fiscal year. But when you look at those and see how vastly different they are, it leads to a lot of questions. And it led us to dig a little bit deeper into that referral data to kind of figure out what was going on. So if we could go to the next slide. One of the first things, of course, we looked at is the referral source. In North Carolina, our largest referral source is physicians' offices, and they're represented by the gray section in the middle of all those bars. The bars are the referrals per month. Our second largest referral source is parents and caregivers. They are the dark blue bar at the bottom of those graphs. As you can see, it's considerably less than physicians, but the light blue bars at the top is literally all other referral sources. The referral source in third place behind parents isn't even close. So we tend to kind of lump everybody else together as other referral sources. And as you can see, in April, the bottom fell out, and it fell out for everybody. We saw a huge decrease in referrals across all sources, but the rebound that happened through May and June and continues to happen now has not been even. By June, physician referrals were almost back up to where they were pre-COVID. Referrals from all of those other referral sources were starting to get close to where they were pre-COVID. But referrals from families are still much lower than we're used to seeing this time of year from families. So if we could go on to the next slide. The other thing that we saw when we started digging into our referral data is that the referral closures COVID had a huge impact on the percentage of children that enrolled in the program. The dark blue bar that starts out much higher than everybody else, that's the percentage of our referrals that resulted in the child enrolling in the program and an IFSP being developed. And as you can see, most months it was somewhere between 40 and 45%. The other two lines on there, the light blue is attempts to contact the family were unsuccessful. And the green is that the parent declined eligibility determination. Those are our three most common closure reasons. And I'm going to tell y'all, this is one of the weirdest pieces of data I have ever seen about our program in 11 plus years. is what happened in March, where they all just converged at around 25%. We've never seen anything like that before. It's the lowest level of IFS, children enrolling in the program, and much, much higher levels of parents just not picking up the phone or saying thank you, but no thank you. And it started to untangle after that. March was the worst. March was the worst about a lot of things. But it's still not back to where it was. You can see at the end of the year, we were still at only about, 35% of referrals resulting in enrollment. And we still see, a little bit more, especially of the attempts to contact the family being unsuccessful, I think, than we're used to. But yeah, our referral closure disposition just really changed. But where it really started to make sense was when we put these two factors together. It's sort of like, yeah, we're seeing less kids getting referred, we're seeing less of them, we're an IFSP developed, but it really starts to make sense if you'll go on to the next slide when we look at those two things together. So the takeaway from this one is that the trends are different, but the result is the same: fewer enrolled children. This is looking at the percent of children where the referral resulted in an enrollment based off the referral source. And the dark blue line at the top is referrals by parents and caregivers. And in normal times, 60+% of referrals from family enroll in the program. It's just when the parents or caregivers were interested enough that they were the ones that made contact with us. I mean, it makes logical sense. If they're found eligible, of course they're going to enroll. It was their idea. Whereas they're considerably less likely to enroll if the referral came from a doctor's office or some other community organization. And you can see that on the light blue and the green lines at the bottom, that those referrals from physicians and from other sources are just, they don't enroll as often. Well, what you can see with that blue line is the percent that enrolled, again, obviously fell in March. The percentage of referrals from families that result in enrollment is pretty much back up to normal, but we have way less referrals from parents and caregivers. So even though the percentage has bounced back up, the result is fewer children enrolling when the referral source is the parents, because the parents just aren't referring kids. For physicians' offices and other referral sources, they're still low. The percentage of kids referred by those folks that are found eligible is still lower than it was pre-COVID. So those referral sources that have bounced back up, fewer of their kids are enrolling in the program. So when you add those two things together, you get this just sort of steady drip, 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 drip of our enrollment just going down and down and down. So until like I said, it was like a light went off above my head when I saw this, that getting back to a place where parents are comfortable in, referring their children into the program, until we can see that happen, our enrollment is not going to be back up to where it was before COVID hit. So does anyone have any questions?
You do have a question in the chat from Dave Williams in Tennessee. As of July 2019, what was the pure number of enrollees?
I'm going to try to remember this off of the top of my head. We do a monthly head count report every month. We had some of the highest head counts we had ever had in our program prior to COVID hitting. And I want to say our daily we took a snapshot on the first day of every month, and it was up over 11,000 children, I think, in the early parts of fiscal year 19-20. And right now we are down just barely over 9,000. We've seen something like a 16.5, or a little bit more than that, maybe like an 18% drop in enrollment and that's just thinking about last week's number. So it goes a little bit further than through the fiscal year. But yeah, it was kind of devastating for us. Our head count number from this past December 1 head count is going to look great. Next year's December 1 head count is not.
Okay, and Jennifer Barrett-Zickus has her hand raised. You want to unmute, Jennifer? You have a question for?
Yes, thank you. This is really interesting, and thank you so much for sharing. One of the questions I had, of the children who were found eligible and the families accepted early intervention services or are participating, have you seen a difference in either the diagnoses? Are they more involved, auto-eligible? Are you seeing any characteristics or different in income? I'm just curious. I have a theory that there's just so much going on, so I'm wondering about those that are saying yes. Is there something about that population that we could glean from?
I know that one of the first things we looked at, because we were concerned about whether our child population was changing, was we did look at the racial and ethnic demographics, and those have not changed for us. We're very, very excited about that. That our population, that our referrals and our population of enrolled children still match the birth to 3 population in North Carolina on sort of the racial and ethnic demographics. I think especially in that March time period, like so many other states, there was a point where we were practically shut down. We were trying to figure out how to do things virtually. It was impossible to do evaluations. So there was a period of time in there where if you had an established condition, then your likelihood of being able to sort of get in and get enrolled was better than kids that were going to need some sort of evaluation, because we had to figure out how to do evaluations telephonically or through teletherapy or through evaluations. So, it's been a while since I looked at that data, and now it's the first thing I'm going to do when we get off the call probably. But yeah, I think there were some significant differences in the early point of the pandemic. As we've cranked everything up to be able to do the virtual evaluations, I think it's leveled out a bit more. But yeah, one of the issues that's been brought up repeatedly is that not seeing your child in the context of other children their same age can make it more difficult for families to sort of spot developmental issues. And so that's probably having some bearing on referrals as well.
Yeah, that's so funny, because pre-COVID, you saw, or we would see a higher referral rate around those times where families would gather. So like January, and again in the summer, you'll see those pockets. So kind of with not gathering, they're probably at the delays, speech and language delays, not pure developmental diagnosed conditions would be the same.
I had never put that holiday thing together. What you just said was like this little epiphany for me. I always assumed that our huge number of referrals in January was a result of families not wanting to do referrals during Thanksgiving and Christmas and just putting it off into the new year. I had not thought about that they may have gone to, large gatherings and that involved a lot of other children and potentially spotted issues because of it. So thank you.
Barbara, Kathy from New Hampshire says, thank you for this. New Hampshire has reviewed our referrals and enrolled, but I can't wait to go back and break our data out by referral source. So people are appreciating your data. Thanks very much.
Awesome. Thank you.
Any other questions for Barbara? Okay, and feel free to put them in the chat as we keep going, and we'll have a chance to come back later and address them. So now I'm going to pass it to Nate Talion from California. Nate.
Yeah, hi, can everyone hear me? I'll take silence and nods as a yes. And yes, hello everyone. My name is Nathaniel Talion. Please call me Nate. I work in California's Federal Programs and Monitoring section within California's Department of Developmental Services. I'm excited to share some of the things that we've encountered and continue to work through. And as Sharon mentioned, those things that continue to be a work in progress during these unprecedented times, right? As we all collectively navigate the systems that we work within. Next slide, please. So in response to the state of emergency that was declared in California on March 4th, my department issued a directive waiving requirements that early intervention services end at 36 months of age for those children who received early start services and turned 3 during the pandemic, coupled with experiencing issues with transitioning to Part B services meaning that it's those kiddos that couldn't transition to Part B because of the pandemic itself. And what this meant, right, was what this meant for our regional center system was we were able to continue to implement services under that child's IFSP while we were awaiting to transition to that Part B program, considering the delays that they were encountering. I will highlight, though, that these services the services for these cases or for these kiddos were paid through California's general funds through the state. And this really permitted regional centers to continue to provide services and meet those needs despite everything that was taking place. Next slide, please. In terms of what we encountered, we saw a significant uptick in cases that continue to receive these services after the age of 3 in comparative years in relation to the issue directive. And we wanted to track this number because we wanted to get an idea of, who were these cases, who were these kiddos, and also we have the ability to kind of break it down where it was happening across the state. As we all know, California is a very big state, so getting an idea of where this is happening was very important. And as it's highlighted in this graph, once we issued the directive, we saw this significant uptick in cases that remained open and continued to receive services during these unprecedented times. And so that uptick we saw was about 107% increase in cases through our regional center system that continue to receive services through the Part C programs. Again, I want to highlight that these services for these kiddos were funded through California's general fund. I should mention, though, as we look at this graph, as I'm kind of pointing to it, there are cases that remained in our system under Part C, but it's kind of the flaw in our data set because these are point-in-time references. All that means is that these cases weren't closed out at the time when the data was allocated. But I will also add, and it's something that we're interested in and we continue to work through, is that as we start to see schools progress forward, reopening, reinventing, and pivoting how they're going to be providing services through Part B, we are expecting to see kind of this downward trend of these cases that remained open, but in reality, only time will tell. But we do have 1 month of data from August to September. We see a little bit of a decline. So we are excited to see how things will continue to manifest. Next slide, please. In terms of, and Barbara highlighted a lot of the things that we encountered as well, but in terms of referrals, we did experience a decrease. And in comparing the monthly average of children referred to Early Start, there was a total decrease of approximately 19% in January to August. And this was compared to the same time last year. I will add, though, also we are starting to see a slow uptick from month to month, but we can kind of go over some of those pieces in the next slide. So next slide, please. Perfect. So what we have here is we have I'm not too sure what to call the color, but I think it's a periwinkle blue. The periwinkle blue line represents the 2017, 2018 percentages related to referrals. And then the orange color, or the salmon-ish color, represent the 2018, 2019 percentages. And then the dark green line represents, the 2019 to 2020 percentages. Please note that this is from, it's the months that we are looking at is from January, and we have it all the way through to December. So this is really indicative of what had taken place back when, back in March, April, when everything happened related to COVID and the pandemic. And we experienced a significant drop in referrals. And as you can see in comparison to the years prior, it's something that we're continuing to see an uptick, but we're not at those levels at which we once were. In relation to this uptick, and to put it into perspective, in relation to the numbers, just to kind of put it into perspective, in previous years, for last year, January 2019 to September 2019, we saw approximately 6,500 cases referred to on average, or total. While for January 2020 to September 2020, we are seeing an average total, And then for this year, January 2020 to September 2020, the average is about 53.49 per month. So it's still significantly lower in comparison to last year around this time. But in relation to this uptick, we are seeing an uptick, and as this green line shows, from June to July, and this is, I think, a data piece that we were really interested in. From June to July, we saw 3%. From July to August, we saw 7%. Then from August to September, we're seeing roughly about 7% again. We're curious to know how this uptick will continue to take place, considering some of the things that we're trying to work on in relation to referrals, which leads to the next slide. Next slide, please. So what we did as a state was to really get an understanding of the root causes for the reasons why we are seeing these referrals. We know that because of the pandemic, since in March and April, we saw this dramatic decrease. But what's the source? What are the root causes, and how can we help bolster some of those things? So in terms of the research that we completed and the information that we gathered, we saw, and the root causes that we identified were decreases in referrals from pediatrician offices, decrease in families not referring their children due to families not prioritizing early intervention services due to, because they're focusing on basic needs, not having access to resources, perhaps connected to technology. And one thing that Barbara made mention of also is that families not interacting with other families because of the stay-at-home orders and not having that space to kind of, to see others. And I'm interested to kind of go back and look at our data as someone asked the question or brought up the point of, getting together during the holidays, and then do we experience an uptick afterwards because, you're kind of within those realms. Another piece that we came across in terms of root causes, the face-to-face developmental screening events were canceled to comply with state orders related to large gatherings. And then another piece, which is a closure to local education agencies and schools and childcare providers during the summer months, as we would often get referrals from there. And so considering these things, what we wanted to do is get a better understanding of, this uptick and how can we amplify, right, or turn up the volume to make sure that we can address this need, the decline in referrals. Next slide, please. So from there, we reached out to our local partners and had discussions to get an understanding of the attributes of what may have lent to this rebound or this uptick. And we discovered many of our programs utilized specialized regional center staff to concentrate, to have concentrated efforts on referral sources, to connect underserved groups with services and with the appropriate entities. I think another thing that I like to really highlight is the individual relationships that many of our local programs had with, with referral sources. Oftentimes, or I'll just quote what one program manager had told me is, I think what this person had said was, the reason why we're starting to see a rebound is because I have a direct relationship with our local partners, and they call me and know me by first name. And I think that was something that was just highlighted that I think that often gets lost in data. Perhaps this is a qualitative piece that I just want to make mention of. And it's within those relationships where we start to see like how things continue to move in a positive trend. Another piece that we came across to help really address early start referrals was utilization of virtual town hall meetings by our local programs to discuss services and to be part of a community. Granted, many of us, we're all experiencing, even now, we're all on Zoom calls, so how do we connect with others? A lot of our programs really reached out and tried to connect in ways that they hadn't before, which kind of leads to the next piece, is connecting to families and other groups via social media. The big one was Facebook, and I think one of my favorite stories that we came across was one of our regional centers, reaching out to a parent group, and that parent group, kind of reposting like their posts, right, that they're going to have a virtual town hall meeting, which resulted in people attending that virtual town hall meeting. I think what the next steps that we have to identify is, what the referrals look like after those types of events, but those are things that are the work in progress that Sharon had mentioned earlier. Next slide, please. So in terms of what we did, as a department for the state, some of the things that we started to move towards to help support referrals and support the conversations that we're having with our regional centers was developing outreach materials, public service announcements, physician referral flyers, and social media blasts to share with other early start partners and other agencies and other community stakeholders to distribute for the public. Also, I think a big piece too was engaging with partners to share outreach materials, to connect families with Early Start, with our programs, by way of email listservs, social media, and website announcements. And these partnerships have included our Family Resource Center network throughout California, our ICC, or Interagency Coordinating Council, First Five California Department of Social Services and Public Health, as well as California Department of Education. And I'll add also is that we believe that through our continued collaboration with our local partners and making those partnerships along with our community stakeholders and combining those continued efforts together, we really believe that we'll remedy and also innovate our practices to meet the needs of the families and the children that we serve through our system in California. Next slide. And
Time for any questions for you, Nate?
are there any questions?
Anything in the chat, Sharon, or?
Yes. So we have Alice Ridgway said, we tracked EIS over 3 as well because it impacted our budget significantly. Great data for planning to provide EIS over 3 for children with summer birthdays anyway. Like Missouri does, we cut off EIS over 3 on August 31st. Oh, that third family bullet is genius.
Yeah, I agree. That bullet about how when you don't see your kids in the context of other kids. Yeah,
yes.
That was enlightening.
Yes, I agree. Thank you for that. Yeah.
And we have something from Dave Williams. Have staffing levels been able to adequately continue desired levels of services and then during the recovery?
Yes. So I didn't make mention of this during kind of this overview, but in terms of staffing, all of us have had to reinvent, right? And how our practices related to services take place. And so our department issued directives on being able to provide services via telehealth and meeting needs in that way. But in terms of just, I guess I want clarity on the question in terms of staffing. Were there issues with meeting the needs, or are we talking about meeting the hours that are allocated for a kiddo? If you could elaborate a little bit more on your question. And I guess I can open the chat too to read it.
Well, if I may, I can ask the question if you can hear me.
Yeah, I can hear you. Is this Dave?
Yes, it is. Dave from Tennessee.
Hi, Dave.
We have extraordinarily high caseloads in Tennessee. Our staffing levels are stretched. And during the time period of COVID, of course, there are hiring freezes and things of that nature that affect us all. Things to be expected. And as we recover in our child population, we are not necessarily able to increase the staffing to go along with those higher numbers. And I just wondered if anyone else had seen similar circumstances.
Sure. So I will say, especially in relation to the data that I had gone over, we have these cases that remain open because they can't transition to Part B services. And then we have this dip in like referrals where, our regional center system, our local partners aren't getting those numbers that they're used to. But as we start to see the referrals rise, that question is starting to come up. How are we going to be addressing, the staffing needs to meet all the needs of the kiddos in terms of case management? So we are starting to have those conversations, the plans and how we're going to be moving forward. And it's collective, it's collaborative, it's everyone kind of working together to identify what makes most sense and how we can progress forward to keep things at sustainable levels. And all of those things they're being mapped out now. Some of those conversations I am a part of, some of them are bigger than me, but nonetheless, just to address your question, that's something that we're trying to map out in the moment.
Thank you very much.
Thank you, Nate. Appreciate it.
Yep. Thank you, everybody.
Okay, we're gonna go on. I'm pleased to introduce Maggie McCall again. So Maggie is from Indiana, and she is going to be sharing with us some interesting changes they're seeing in their family outcomes data. So Maggie?
All right. Like Amy said, I'm Maggie McCall. I'm the Part C data manager for Indiana. I've been in my position for about 4 years. I was finally feeling comfortable, and then COVID hit, so everything changed, obviously. Amy, if you want to go to the next slide, please. Just a little bit of background on our family outcomes process. In Indiana, we use the original ECHO survey, and this survey is only offered when the child exits the program. So we collect the results of the survey all year long. Under normal circumstances, the survey is typically hand-delivered to the family during the last in-person meeting with their service coordinator. And at that time, the family has the option to complete the survey during the meeting, or they can return it via email or US mail to the service coordinator. When the survey cannot be offered in person, the service coordinator mails or emails a copy of the survey to the family. And we've had some service coordinators who are very dedicated to getting responses, and they have texted the family the questions one by one, noting their responses, which I think is pretty cool that they're dedicated to getting the responses. And then when the survey is completed and returned, it's data entered by the local program staff into our collection tool, which is maintained by Indiana University. Next slide, please. So the navy line is the total of children exiting during this month. This typically is around 1,000 children per month. The yellow line is the number of completed family outcome surveys, and we usually have just over 400 surveys completed each month. The teal line is the number of surveys that were not completed. This could be for any reason, such as the family declined, the family did not respond to attempts to collect, or the data simply wasn't entered into the system. We fully expected the number of surveys completed to tank starting in March, but it didn't. In fact, we saw a small increase in the number of children exiting in March, and then the number of children exiting each month decreased. May 2020 is, to me, the most interesting month. We had the fewest number of children exiting, the number of surveys not completed decreased, and the number of surveys completed held strong. Next slide, please. We started to look at the breakdown of why surveys were not completed. The navy line shows the number of children that did not have data recorded. We saw a slight increase in this in March as Indiana was shutting down, and we switched from providing service coordination in person to virtual. During this time, all personnel were stretched so thin that I believe entering the data fell through the cracks. Then we saw a huge dip, which I'm attributing this to service coordinators and parents getting into the groove of virtual work. This will take more digging to know for certain though. The teal line shows the number of families that could not be reached or did not respond to the service coordinator's attempts at collecting the survey. We saw an increase in April. This is when Indiana went under a stay-at-home order, and our parents' daily lives changed very drastically. The yellow line shows the number of surveys that the service coordinator did not offer to families. For me, it never feels good to know that there are families who were not offered the family outcome survey, and that's something that we're working on, but I was baffled that we saw a decrease in this from February to March. Now, this could be that service coordinators were not administering the survey, and they did not report this in the collection system, as we did see an increase in the number of unknown responses during this time. I apologize for my child yelling in the background. The red line shows the families that were offered the survey but declined to complete it. We saw an increase in March as the awareness of COVID-19 grew and families' daily lives began to change. But overall, the numbers held pretty steady for the first 6 months of 2020. At the very bottom of the chart, we have the number of families who did not complete the survey due to the child passing or the family moving before the survey was offered. These thankfully stayed low, but could again be in the number of unknown responses. This chart goes to show that our families always surprise me. We saw an overall increase in families that believe they know their rights, are able to effectively communicate their child's needs, and are able to help their child develop and learn. The most dramatic increase being the percentage of families reporting that they're able to help their child develop and learn, which is the yellow line. Prior to the coronavirus pandemic, we had decided to align our state with the Family Guided Routines-Based Intervention module because we thought, why not throw something else at us? We thought we were in a really good place, and we started to train our providers on this in March. and used the sudden switch to virtual early intervention services as a way to help our providers become more comfortable with being hands-off and coach the family through activities. We attribute the sudden shift to virtual visits and the family member needing to be fully engaged in order to complete a virtual visit in this increase. Next slide, there we go. We obviously have a lot of work to do in order to make sure that every family is offered the family outcome survey and the data is entered into our system. But this has provided us the opportunity to reflect on our process and think about the capacity for change moving forward. We are currently developing a new data system that will contain all of this information, which will no longer require the data to be entered into a different system, and will have reports available of those children who have no data. We are hopeful that this will decrease the number of unknown responses. We've also found many silver linings during this time. The transition to virtual visits has led to families being more engaged in sessions and providers utilizing coaching techniques. We have seen an increase in communication between families, providers, and service coordinators. And our families have been completing surveys without service coordinators present, and it hasn't negatively impacted the number of surveys we have completed. Overall, we've seen an increase in comfort with use of technology from families and providers. This is very encouraging to us in our plan to move the family outcome survey to an online format in the future.
Okay, any questions for Maggie, either in the chat or if you want to unmute yourself?
Maggie probably wants to know that Jennifer Barrett-Zitkus said, Maggie, no need to apologize. We all understand you're doing a fantastic job.
Thank
So
you.
so if your little one pops in the screen, we'll be happy to see them.
Well, she might.
Absolutely. Okay, Tony, you want to kick off our small group discussions? You're still muted, I think, Tony. Yeah.
Thank you, Amy. So we will be randomly assigned to a group. There will be 3 groups. You see them on the screen: referrals and enrollment services, including telepractice and family outcomes. They will be co-facilitated by our guest speakers, as well as DaSy staff, Amy, Sharon, and me. When you enter the room, time permitting, group size permitting, we can have brief introductions. The DaSy staff facilitator will put a link to the Padlet, and you'll see what that is, and we have it on the screen right here, so you know what it looks like. So that link will be placed in the chat, and you can grab that link and place that in a web browser and pull that up. And we're going to use this to list ideas or challenges related to COVID data disruption. And you can, and we'll provide a little more information when we get into the breakout rooms. And then we'll have discussion around the entries. And again, both our guest speakers and DaSy will co-facilitate these discussions. The DaSy facilitators will record notes and to use for the breakout discussion.
Tony,
Yeah.
I think someone had their hand raised a minute ago. Was it Kathy?
Yes, that was
Did you
me.
want to? Good. Why don't you unmute? And did you have a question for Maggie?
I did. I just wanted to go back to the slide that had the yellow bar that showed the 3, or the yellow line. And I wasn't sure, what is that yellow line? Is that they know how to help their child?
Mm-hmm.
I'm sorry.
That's help their child develop and learn.
Oh, okay. So I see it's kind of interesting how it declined, and I'm wondering if that could have had something to do with the virtual sessions.
It's possible it did.
Yeah.
I'm kind of hopeful that it was that our service coordinators weren't present. So I would actually like to see, and this sounds very weird, but like to see our service coordinators not be present and see if that has an impact on our data. If it dips down and then maybe bounces back up, just to see how that plays out. Families completing that the survey online or mailing it, however that would be, but just not with the presence of another person who possibly would be influencing their response.
Thank you.
Thanks, Tony. I knew you'd want to do that before we went into groups.
Oh, absolutely. Thank you.
Okay, so I think Rachel is gonna pop us all into a group, and then we'll come back together in 20, we're gonna spend 20 minutes in these small groups.
Opening the rooms now.
Thank you. I think we're all back. Okay, so the DaSy staff in each room, we've jotted some notes down. We're going to share a few key takeaways from our notes, but then open it up to anyone else in our groups. Please also contribute anything we may have missed. So in our referrals and enrollment discussion group, we talked about that most people are seeing a rebound in their referral rates and eligibility, but there's still a lot of variability in terms of families' preferences for participating and actually receiving, moving to initiating those services. And some of that has to do with families' opinions and views on COVID-related restrictions around in-person services, whether they don't want to have to wear a mask. And so there's a lot of that, a lot of differences we've seen there that are then affecting the progression into service initiation. Several states in our group mentioned that they have added closure-related or state, local, or national emergency-related reasons to why referrals were closed or why children exited from the program. So added those to their data systems as new options. We also then, we talked also about how some states were already seeing lower referral enrollment data because their birth rates were dropping over the past couple of years, but then you have the COVID related impact on top of that. So it'd be interesting to kind of tease out how and the magnitude that the COVID related changes had on those data changes. And then we talked, this came up in our session yesterday too, about, we always get so hung up on looking at these data like referrals are going down, that's a bad thing, but there's no moral judgment right now in anyone's data looking lower than you may want them or expect them to. There has to be a human element behind all of the interpretation of these data, where we understand that families they have to prioritize having basic needs met. And Vermont was in our group, and they shared a really genius outreach idea. The outreach is another key theme for our discussion. Outreach is so important, and it shouldn't stop, and maybe now more than ever. In Vermont, the early intervention referrals were going down, but the providers, the staff in the local areas participated with another community resource program to distribute diapers to homes. So while that did not fall under the early intervention program directly, they had a presence in the community still, and they're seeing people now circle back and say, hey, I remember you, you helped bring diapers to my house. And so it's helping to bring awareness to the program and contributing to some of that rebounding of the referrals. So Barbara or anyone else from our group, did I miss any highlights?
I'm just really excited to hear how many people are looking at this stuff and trying to cut it in different ways and compare different data points to each other, and the excitement for going back and doing some more of that to see what their state story looks like. So I encourage that for everybody. Go digging.
Go digging. So group 2 had a thread. I can hear it, not only the drilling down and analyzing your data and trying to get some answers, but that notion of community outreach. And one of our states started that conversation by saying the biggest question she gets from leadership is, who are we missing? Was the equity question. What families are not getting what they need, and where are they, and how can we find out who needs something? And so that pursued a conversation across quite a few states about community strategies and connecting families' difficulties with accessing technology or just all the things going on in their lives, and particularly rural communities, underrepresented population. The states talked about analyzing their data to be sure that they were not having disproportionality in their data, looking carefully and worrying and dealing with it when they did. One state talked about all the work they've done with the reservations that were closed initially during COVID. People couldn't go in, how the school districts were responding to that. So lots of good community talk. The other thread I think that went throughout our discussion, and then maybe Nate would see if he had anything to add, was the notion of what's going to happen with our child outcomes data, what's going to happen with exiting, the children exiting and not being able to do exit evals, and what will that do to your completion rate. And then certainly, last but not least, is what does this really mean in terms of the services we are able to provide? You know, do we really have data on what services we've been able to provide? And Nate, maybe, is there anything I missed that you might want to mention right now?
No, in terms of what you made mention, that's all pretty much that we covered. Kind of ended sooner. Definitely could have had a few more minutes to talk about things, especially as we talk about data completeness, especially as we talk about services. You know, it makes me think about the how services are actually going, what is going to be telling us in terms of, you know, are we successful? Are we going to be successful with our programs? But a lot of good conversation, but you covered everything.
And I think the last piece, Nate, that we did cover, but briefly, was everyone anticipating a great challenge in setting your targets for the 6 years that we have to submit. You have to submit February of 2022, that, you know, your stakeholders are going to need data to inform those recommendations, and what will that look like, and what will those data notes look like, and that's, everybody's faced with that.
Thank you, Sharon. And for our family outcomes group, we had some challenges mainly around response rates. And however, along with that challenge came some opportunities, and we'll get to that in a second. So seeing low response rates and knowing that data systems, some of the data systems don't collect email addresses, and if they do, they may not always be up to date. And then another challenge has been survey fatigue. People are getting burned out by a lot of surveys that are coming through, even more than usual because of COVID. And then in addition to that, with parents working and getting notices and just making decisions about their children going to school and everything everyone is experiencing now with these changes that have come along, that answering a survey is not on the top of the list. And then going to the opportunities, though, with the low response rate, it has provided that opportunity to move to more of an online system, to get data, to get the survey data, the family outcomes data in. So we had a state that has seen an increase in their response rates due to that. And also with moving to a more, I say more online, so I don't think anyone was strictly online, but the moving away from having somebody hand deliver the survey, because we all acknowledge that the potential to influence a parent's response to the questions is always present, or I shouldn't say always, but is present to an extent. So maybe there's less influence or less biases coming through when that online portion is introduced, or at least when the hand-to-hand delivery is removed. And Maggie, do you have anything we should add, or anyone from our group?
I don't. We had a great discussion with lots of ideas on how everyone is administering their survey or thinking about administering their surveys in the future.
That last point about the not having someone there, I find fascinating. We've had the ability to do our survey online for a while for family outcomes, but in looking at our fiscal year 19-20 data broken out by quarter, the quarter where we basically had to have everybody doing it online, our response rates for African American and Hispanic families went down quite drastically. because pre-COVID they had been more likely to send theirs on paper than to do it online. So we were already looking at it in terms of the digital divide issue, but now I want to go back and look at all the past surveys and see if our scores in Q4 when everyone was doing it basically online went down. And now I'm curious to go back and look and see if the people who were doing it online themselves were always scoring us differently than the people doing it on paper.
And Barbara, representativeness is absolutely an important point to make as well.
Yeah, I definitely agree. You know, I think as we hear some of these things like digital divide. It's something that has become, that we know before all of this is something that we were aware of, but as we start to progress forward, with considering where we are now, it becomes more and more apparent. And keeping these issues at the forefront of our perspective is going to be very important moving forward.
Absolutely, Nate. And Pew did a research study in 2019 around people who are accessing and using the internet. So overall, even though that's increased, we still see differences.
Alice put in the chat, we've been looking at the return to in-person visits and the extent to which that is representative, which echoes some of the conversations in at least group 2, and it sounds like for all of us.
Okay.
Any other broad comments? Anybody want to jump in if you've been holding on to a thought or an observation, an extra question? We have about 5 minutes and we just have a couple of resources to share. Alice loves Padlet. Me too, Alice. I'm just getting used to it. Yeah. Any ideas for future TA? We certainly would appreciate those. You can pop anything in the chat you want, either about the session, about future TA needs. Any comments you have? I'm wondering if somebody would make an observation or two for us, or do you have any questions for your state colleagues?
I have a comment. I'm fairly new to working for California, and I was really excited about coming here today and kind of talking with everybody about what everyone's experiencing. And it just really validates, the conversation that we've had just really validates what I was assuming that I would encounter, is that we're all encountering similar things all across the nation. And not only we're encountering a lot of similar things, but we're also doing our best to address things in some similar ways. And I appreciate the conversation that's taken place, because it's given me a lot of ideas to bring back and say, are we looking at this? Are we looking through this particular lens when we're looking at this data? Are we thinking about these groups? So just wanted to make that comment.
Thanks, Nate. I think that's appreciated by everybody on this call. This is quite a network, and you'll find that you'll share a lot and then you'll get a lot in return. So you've echoed nicely, and maybe if we go to the next slide, somebody still please pop things in the chat. Alice says, ongoing ways to share data with each other, like we used to do with our early those data sessions we did, Alice. Is that what you mean?
I'll unmute, it's easier. No, I was even thinking online, if there was a way that someone could put out a question, like, what does your referral rate look like weekly by referral source using family, primary healthcare provider, and other? And we all did that to the extent that we could. Then we get on and we all just start sharing, like, well, what does yours look like? What does mine look like? Oh, I did that,
yeah.
I did that.
Yeah. So Alice, that's a great thought about using a listserv for that. And that's certainly an idea we'll take back. That's certainly easy enough to do. I think there was some conversation about it already. Donna Spiker, one of the co-directors from DaSy, just put a thought about what we could develop as a TA matter. Echoing both what Alice is saying, but more specifically to Nate's comment, just want to make sure everybody on the call is aware of some of the ongoing learning communities and TA opportunities. And most of these DaSy partners with ECTA, but you can easily get a list of any of these or access them through the DaSy website. We have a Part C Data Managers Learning Community. I'll pull up a slide in a minute on how you can get more information on that. We have Part C Data Manager orientation packages. So if you have new folks in your state or you're new, even if you're not the data manager, we have data overview discussions that can be provided with your team. And then we have other communities of practice that relate specifically to child and family outcomes measurement. There's a BDI users group. There's a COAS learning community. There's a family outcomes data community of practice. Some of you are definitely a part of that. And we have a TS Gold learning community. So again, check the DaSy website out. Make sure that you have access to as many of those networks as you want. We're certainly going to take those ideas back that you're putting in the chat and Alice's. A reminder on those data manager community calls. They are the first Monday of every month. You do not need to be the data manager. They're very well attended calls, 2 o'clock Eastern. If you are interested and you don't have that information, send an email to Heidi Bernstein. Her email's on the bottom. This is a private conversation among yourselves, a good networking opportunity. You get notes from the call, but they are not distributed widely. They just go to the people in the network, and we don't name people, we just talk states occasionally. And if you go to the next slide, resources that if you're not familiar with, I hope you do. Department of Ed has their own coronavirus website. You probably noticed this morning a Part C FAQ, a new Part C FAQ was released this morning, posted on that website. I'm sure we'll hear about it tomorrow in the closing plenary. DaSy website and ECTA websites, all collecting resources on COVID. There's a document that if you have not seen it, and a webinar from last summer that DaSy did on considerations for data disruption. We're working with all of you to gather those considerations, and we'll keep that work moving forward as we work more closely with you as this pandemic unfolds and hopefully eventually comes to a close. And there's the ECTA website. Just a quick reminder, I know we've reached the end of our session. Please complete the evaluation. You're going to get a link notice from the platform that you registered on to evaluate the session, and we really appreciate it. We truly use those evaluations to plan our next activities. And I think that's it. I'm going to pause a minute. We have about a minute. Anybody want to make a last comment or a suggestion? Thoughts? Last words from anybody? Good suggestion from Rachel in the bottom there is to, from Donna, pull out flyers in the event, the resource page about TA centers, and from Jennifer Baraditkas from OSEP, thank you for all you do for children and families. Stay safe during these difficult times. Thanks, JBZ. Donna, great work, everybody. Keep up the good work. And a couple of thank yous from some of you. Thank you to our, join me please in thanking your 3 state teams for coming and sharing their thoughts and their challenges and of course their data. We really appreciate you doing that. And we thank you all for your time this afternoon. So on that note, we will close out the session. Thanks everyone.